Is your dog peeing more than usual, struggling to go, or showing other unusual symptoms? These could be signs of a urinary tract infection. Hi, I'm Lyndall from Vetster, and in this video, we'll break down what you need to know about UTIs in dogs. We'll cover spotting the signs, getting the right treatment, and helping your pup feel better fast. As usual, all of the information in this video has been meticulously reviewed by leading Vetster veterinarians. Alright, let's hand it over to the experts.
Urinary tract infections, or UTIs, are common in dogs. If your dog is suddenly peeing more often, or you notice blood in their urine, it's important to get a vet involved. These symptoms can overlap with other issues, so an accurate diagnosis is key. In this video, we'll cover what to look for, how UTIs are treated, and how to help your dog recover. Let's get started. The most common type of UTI in dogs is a bacterial infection in the bladder. To figure out what's causing the symptoms, your vet will test your dog's urine and might run additional diagnostics. If it's a bacterial infection, antibiotics will be prescribed to treat it. UTIs occur when harmful bacteria infect parts of the urinary tract, like the bladder, ureters, urethra, or kidneys. Most of the time, the term UTI refers to a bacterial infection in the bladder, since that's the most common type. You might also hear the term cystitis, which refers to bladder inflammation. While cystitis is often caused by a bacterial infection, it can also happen for other reasons. It's worth noting that UTIs aren't contagious, even though bacteria are the cause. The bladder stores urine until your dog is ready to go. Even though it's exposed to bacteria every day, a healthy bladder usually prevents infections. Not all infections cause noticeable symptoms, but most dogs with UTIs will show signs like frequent urination, dribbling, or even fever or a loss of appetite. While it's rare, a bladder infection can spread to the kidneys and become serious. Female dogs are more prone to UTIs because their shorter urethra makes it easier for bacteria to reach the bladder, and their anatomy places the urethra closer to the anus, where bacteria like E. coli are found. Kidney infections, which are less common, can occur when bacteria from an untreated bladder infection spread to the kidneys. Bladder infections are most likely in senior dogs or those with diabetes, but younger dogs under 3 can also be at risk. Now let's talk about symptoms. Signs of a UTI can vary depending on how severe the infection is and where it's located. Some dogs with mild infections might not show any symptoms at all. When symptoms do appear, they often include dark or bloody urine, dribbling, frequent urination in small amounts, or trouble holding their bladder. Dogs might also lick their genitals more than usual, strain to urinate, or have wet or matted fur around the groin. In some cases, you might notice lethargy, vomiting, diarrhea, fever, weight loss, or a reduced appetite. It's easy to confuse a dog struggling to hold their urine with urinary incontinence. Incontinence happens when a dog has no control over urinating, which can cause leaks. With a UTI, dogs are typically aware they're urinating but may need to go more often, leading to accidents. To diagnose a UTI, your vet will start with a physical exam and ask about your dog's symptoms. A urine test, called a urinalysis, is usually next. This checks for bacteria, proteins, or other abnormalities. If needed, your vet might also recommend a urine culture, blood tests, or imaging to rule out other conditions. UTIs are usually not emergencies unless there are complications. If your dog is straining but can't produce urine, this is a medical emergency and needs immediate attention. If you're unsure whether your dog's symptoms are serious, it's best to check with your vet. Quick treatment is important to prevent the infection from worsening. The main treatment for UTIs is antibiotics. The type of antibiotic depends on test results and where the infection is located. Your vet might also recommend pain relief, anti-inflammatory medication, or fluid therapy to support recovery. It's crucial to finish the full course of antibiotics, even if symptoms improve, to avoid antibiotic-resistant bacteria. Most UTIs clear up quickly with the right treatment. After treatment, your vet might suggest a follow-up urine test to ensure the infection is gone. If your dog gets UTIs frequently, your vet may recommend long-term strategies, like a special diet or addressing underlying conditions that contribute to infections. Home remedies aren't effective for treating UTIs. Bacterial infections need antibiotics prescribed by a vet. While some remedies, like cranberry supplements, aren't harmful, they lack strong evidence of effectiveness. Trying these instead of seeing a vet can delay treatment and make your dog's discomfort last longer. Always follow your vet's advice and only use medications prescribed for your dog. UTIs happen when bacteria travel up the urethra into the bladder. The most common cause is E. coli, a bacteria often found near the anus. Kidney infections can develop if a bladder infection goes untreated, and bacteria spread to the kidneys. Certain health conditions can also increase the risk of UTIs by weakening the urinary system. Female dogs, senior dogs, and dogs on immunosuppressive medications are more prone to urinary tract issues. Conditions like diabetes, Cushing's disease, kidney disease, bladder stones, and tumors in the urinary tract also increase the risk. If your dog has any of these conditions, keep an eye out for symptoms. Hydration is one of the best ways to maintain urinary health. Make sure your dog has access to clean, fresh water. A balanced diet also helps, and in some cases, your vet may recommend a special urinary diet. While cranberries or supplements are popular, there's little evidence they prevent urinary issues. If you notice changes in your dog's urination, energy, or behavior, it's important to contact a vet. Many urinary conditions share similar symptoms, and some may be emergencies. If you're unsure or need advice, you can connect with a veterinary professional through a virtual vet appointment on Vetster. Acting quickly will help your dog feel better and avoid complications. Don't forget to like this video and subscribe for more tips on keeping your pets happy and healthy. See you next time!